Morning, one and all. Greetings from Kochi. Myself, Dr. Shashank Agrawal, is going to present this article on functional outcomes of localized prostate cancer treatment, which was published in JAMA in the January month of this year. So the comparison of the adverse functional outcomes between different treatment modalities existing for the localized prostate cancer was the main objective of this study. So this was an observational cohort study based on 5 population-based SEER registries between 2011 to 2012 and were followed for the next 10 years. As per the prognostications, the patients with the localized CA prostates were divided into 2 groups. First is favorable prognosis, which mimics the low as well as intermediate EAU risk stratifications, in which the patients were offered either radical prostatectomy, brachytherapy, EBRT, or active surveillance as the treatment options. Second group was unfavorable prognosis, which mimics the high-risk localized CA prostate as per the EAU classification. And in this cohort, either radical prostatectomy or a combination of EBRT with hormone injections were given as the treatment options. Outcomes. The 10 years outcomes, urinary incontinence, urinary irritation, bowels, as well as hormone function domains were measured epic and the higher function. 1,062 patients, around 440 patients were included in the study, and 1,877 patients comprised the favorable group, out of which 56 patients opted for the radical prostatectomy, 20% patients opted for the active surveillance, and rest of the patients opted for the radiation therapy. While 568 patients belong to the unfavorable group, and out of which 64 patients opted for the radical prostatectomy, which was done predominantly by the robotic approach, and rest of the patients favored the radiation therapy. So the results were distinctly illustrated as per the prognostic, and it was published separately for the favorable as well as unfavorable prognostic group. Coming first for the favorable group, if we look into the curve, the radical prostatectomy, the blue one depicts the radiation while the yellow ones depicts the active surveillance. So coming to the first thing, sexual function, at 10 years of follow-up, there existed no significant difference in the sexual function domain scores in the patients who are going radical prostatectomy versus rest of the 3 combinations. Urinary incontinence, follow-up, the patients who underwent radical prostatectomy were associated with worse urinary incontinence scores comparison with the active surveillance or the radiation therapy. Urinary irritations. At 1 year of follow-up, we can see that the brachytherapy patients were having a worsened urinary irritation. However, at the 10 years of follow-up, there existed no significant difference in either of the treatment arms. Bowel function. Similar to the previous one, at 1 year of the follow-up, the brachytherapy was associated with a worse bowel function score. However, at 10 years of follow-up, there existed no significant difference in the bowel function scores in either group options. Hormone therapy adverse effects. Since no used in the favorable group, so at 10 years of follow-up, all the cohorts responded the same. Coming to the results of the unfavorable group. First, sexual function. The patient who underwent radical prostatectomy or radiation along with the ADT had a similar sexual function at 10 years, 3 as well as 5 years of follow-up. Coming to the urinary patients who underwent radical prostatectomy suffered a significant worse urinary incontinence score at 10 years of follow-up in comparison to the combination of radiation with ADT. Urinary irritation. At 10 years of follow-up, both the cohorts like radical prostatectomy as well as the combination of radiation with ADT scored similar. Bowel function. At 10 years of follow-up, the patients who underwent radiation along with the ADT had significant worse bowel function score than the patients who underwent radical prostatectomy. The similar holds true as far as the hormone therapy adverse effects are concerns, and the patients with ADT along with the RT experienced a more worse adverse effects with the hormone therapy. So to conclude, at 10 years of follow-up, there existed no significant difference in the sexual function as far as the treatment modalities are concerned. However, the patients who underwent radical prostatectomy exhibited a significant worse urinary incontinence in either of the groups, and the patients who underwent radiation exhibited worse bowel function score than the patients who underwent radical prostatectomy. Thank you for your patience list.
Thank you, Shashank.